kire tarikia ya moyo mutini komina kabere amariga ni achakire tari me agusioka korende ime ya ensengima nangike kora ritkuria rera somye gokorekana me Kisii University gari egatia bari bagutukunyara gwekerana no magani no yobere gakunyara gwekerana ase studio. Karibu sana. Good morning.
Good morning.
Ekere ke abantu bagusia bagoteba ngamba kera betera kinirende tigare manyae bakwani
abantu amintombia more Secretary Dr. Onkware Richard, County Director for Public Health, County ya Kisii County.
All right. Karibu sana sa studio. Now, tuateba ngandi tukolia rero bakatunyari gukwandire gorije binyinyi benyamore, especially today there is a town hall event egokorekana gari ase Kisii University. Now, what is the theme of this year when we are talking about World AIDS Day?
So as you have correctly said, every 1st of December, the whole world commemorates the World AIDS Day all over. We usually have a world theme, which is My Health, My Right, basically looking at the inequalities in health, in accessing health. But in Kenya, based on that world theme, we are looking at the outcomes for men and boys. We are also focusing on the triple threat, especially talking about the new infections among the youth, teenage pregnancies, and gender-based violence. So that is what we'll be concentrating on this year. Yeah.
All right. And today we are looking forward to the town hall event on World AIDS Day. Maybe who came up with the idea, and so far, what are we looking forward to?
We are usually guided by the National Ministry of Health, more specifically National Endemic Disease Control Council. And this year, we were guided that we needed to have town hall meetings where we can meet with various stakeholders to really talk about this issue about HIV. And together, we get a way forward on how to end HIV, because we have a target of 2030. In fact, the president has put it by 2027 that we should end AIDS as a public health problem. And you know, this is 2024, which means we only have 3 or so years. So there is need to bring everybody on board, including the media. And we thank you for doing this. We need to have this conversation together. Yeah.
Now, for some, let me say the last 1 month, or let me say this year, there is this girl, and it was somebody Kerubo, it's Kerubo. I think you saw her stories early this year. Akisema how the youths are like, Mimi, nitashare, I'm going to share this disease, my friend. It is your problem if you don't want us to use protection, or if you don't want to be safe. Me, I don't care. You know, and it raised alarm as a mitandao, and the youths, they were like, hey, people, we need to wake up. If this is what is really happening. Among the people, HIV and AIDS, so the knowledge used to be shared, and we used to have it as a whole topic in class 7. Class 6, 7, and 8. There was a topic about HIV and AIDS that we used to talk about. From stigma, everything, the ways of spreading HIV. But now it is like, sisi ndo tunataka tuisambaze venye tunataka. And then you get now the numbers that are coming out. Girl child is affected more, especially 18 to 35 years. And men, the wababas age, when you wamekwa pale. And then you find young boys with the old women, the numbers pia ziko pale. And then again, when you come to look at what the babas they contract it more, but the men die more. What are the numbers in Gusii? So that tumayota kakoligeringa ki, easy facts now, are they real? And what are the long-term effects after what we are doing right now? But the numbers, how do they look like in Kisii? Because I believe in Kisii County, they are among, Goseme ya Gusii, we are among the regions where tunakuanga ranked pale top 5.
Yeah, so let me start by saying that we have come a long way from the 1980s, when we didn't have a lot of knowledge about HIV, now we have made a lot of advancement. We know what is HIV, we know how it is spread. We have developed very good drugs that are really helping our patients. Now, in terms of statistics, Kisii County, let me take you back like 10 years back. Our prevalence used to be 8.9. Currently, it is 4.4%, but we have dropped it, but it is still higher than the national prevalence, which is 3.7%. And for your information, this region, the western region, counties usually have the highest prevalence rates. And it is true that women in general have a double-digit prevalence compared to men. And unfortunately, despite that, it is men who are actually dying more because of the poor health-seeking behavior. They usually come late to our clinics with advanced disease. And even after they are diagnosed, their adherence to medication is also not very good. Yes, the youths currently, in terms of new infections per year, they are leading. Even though the numbers, if you compare the total numbers of youths with the virus, is not as high, because the youth is a transition period. People move from being a youth to adults. But we are very concerned about the new infections. That is why I told you one of the issues that we'll discuss is new infections among youths. And youths should be well informed that we have different types of viruses, HIV, the HIV virus. There are subtypes. And there are some that are very virulent and there are some that are not. You might think you are spreading the virus and actually get the more virulent virus that will take you down very easily. My advice is, if you get it, please, we have medication that will bring that viral load down to almost zero. You will lead a healthy life like anybody else until you reach old age. You will, if you are a lady, you'll be able to give birth to children who are HIV negative. You'll take care of your family until you're old, like anybody else. So the issue of spreading, that is something people used to talk about some time back. We are beyond that. We need to make our youth understand that, number one, let them protect themselves. Number two, let them be taking tests on a regular basis. And if you're positive, please take medication or advice as you know, advised by the medical personnel, and you'll live a healthy life. Yeah.
But again, as a department ya public health and sanitization, kama kanyoranga kireto kwandra igori kirigera World AIDS Day, I'm sure noni miaka ya kwa vile kunyara kuri gocha how the transition and in the treatment of HIV and AIDS yabeire. I'm sure nga ekere barenge kuri na marioga yega yo kunyara gokonya bantu kunyara gotange binyi benyamoreo. They were looking at a certain vision. You see, like our president says, Vision 2030 is trying to make sure that HIV will be no longer a public health program in the country. But the long-term effects have affected with what that is happening right now. Youths sharing the disease recklessly. What does it mean?
It means that we as stakeholders need to come together, just like what we are doing right now and today at Kisii University and in various other forums. We need to discuss this. We need to meet with youth forums. We need to create safe spaces for the youths where they can come and share and be taught about these issues. Like in Kisii County, having youth-friendly centers where the youths, you know, sometimes they do this because they are not engaged. So if you can have these safe spaces like the youth-friendly centers where they can come play games, and as they do that, they get information, they get tested, you know, and for those who are positive, we usually have clubs, and they are able to share their experiences with the disease and the medication, And that way, most of them are able to see, oh, my friend has it, and he or she is living a normal life. So we as stakeholders, we cannot remain silent anymore. We cannot bury our heads in the sand and assume everything is okay. We really need to engage with everybody, especially the youths. And remember, most of our youth are in schools and colleges. So we need to bring on board the management of these institutions, our schools, our colleges, so that they also have programs within those institutions that address the various issues that lead to the spread of the virus. Yeah.
All right. Mbia bono kegimo mwancho muligererio KCTV ogendrete kubwatyo murobire bwenyoni emambi yarere me studio nigo mubwato mu county director of public health and
Sanitation.
Sanitation.
Yes.
Najua tulizoea sanitizer.
Wakati wa COVID.
Yeah, time ya COVID really taught us a lot. So, so I'm struggling between, is it sanitizer? Money sanitation. Yeah, tuginigo abantu insengi mabagenda te kweri kan gochesiri kuryo kunyara komanya abantu igoro yendwari ejiga yenyamoreo yaberige kunyara koleto bakomo imiye insengi makulende the numbers as you can hear chakere for prevalence yaringe
8.9.
Now it is 4. But don't you think the numbers are about to hike again with how the youths are behaving recently, don't care? Ama you got it covered?
We are also concerned. That is why we are actually organizing for these stakeholder meetings to ensure that that does not happen. Yes.
All right. But, ekereto kuligere linonye, orobango rwagusirira ruha the numbers coming along. Maybe me agusi.
Numbers machich nagotebi maitokoriere the prevalence ritangani 8.9 abantu bari bamenyete na virusi vya HIV currently about 42,000 in Kisii.
Okay.
And the other indicators we look at, for example, what is the mother-to-child transmission, the pregnant ladies, how many are transmitting the virus to the unborn child, because that is also one of our concerns. The EU, it has come down. It used to be 16.7. It is currently at 6.7%. But the target is to have less than 5% of the mothers transmitting the virus, so that any mother who is positive, a child has a right to live without HIV. So that is one of our main interventions to ensure that all mothers come to the hospital, they get medication, and we have children without the virus.
Yeah.
Then the other indicators, of course, is the gender-based violence, because it leads to the spread of the virus. And the most important thing, at the end of the day, there's something called viral load suppression. If you are virally suppressed, and I will know my thing about viral suppression, virally suppressed, you are not able to spread the virus to your partner. Ekeretura ikegabu, abantu aba 42,000 who have the virus. If they are virally suppressed, then we will not have transmission of this virus. So currently, we have about 40,000 of these 42,000 patients on treatment, on ARVs, and over 95% of them are virally suppressed. So we are worried about these other remaining 5%, but we are working on it to ensure that it goes to 100%.
All right.
Yeah.
Now, again, and I still feel like it still gives jinx a lot of people. kogenda kupimwe binyenye biga, it is not joke. As much as more everything I can even test at my own house, lazima nitapiga hata drinks kama 5 hivi nikiamka nipate results zilishatoka. It is still scary to do the same. Now, what is the rate of accessibility to HIV testing centers and counseling? Because again, there is nothing that can finish you completely. Kama mtu umeenda pale kupimwa HIV and AIDS, alafu siku hizi it is a must. Ukienda hata kama ni malaria utapimwa HIV and AIDS. Ukienda hata kama if you are lactating mother or pregnant mother utapimwa. Like it doesn't matter, you'll have to be tested HIV and AIDS. So alafu mekonya urochakre kokotebinga, when last did you know hizi maswali, as much as they're asking because they want for the knowledge and maybe for the record, it's still scary process. Gusa also you are done. Like you're done. I experienced one and I was like, "Sindo kuniambia tu kama niko nayo nijue."
Instead of
kushinda umenichukua hiyo process mrefu, and it's like, "Are you doubting yourself?" Daktari, what you are doing, I'm not agreeing with the same.
Niambie kwanza results.
Niambie kwanza results and then you get to process ukianza kuni-advise kwenda mbele, you know. So what is the accessibility?
First of all, some years back,
Yeah.
I would agree that it was somebody had a right to be scared. Because of two things. Number one, we didn't have the medication. ARVs were not available, and if they were available, they were very expensive and only for the rich. Secondly, there was a lot of stigma.
Yeah, sure.
We still have stigma,
Yeah,
but
we
it has
still
gone
have.
down. So you can imagine if you're getting tested and it turns out positive. Number one, we don't have ARVs for you. It's like you're dying. Number two, the stigma that comes with it. So people got scared of getting tested. I would want to say that that has changed a lot because number one, we have life-saving ARVs, where people will live a healthy life and to old age. Stigma, of course, has come down. The availability of the testing sites, in fact, all our facilities are able to test. We have 161 public health facilities. We also have faith-based facilities and private facilities. A total of 131 facilities in total. Put it at around maybe 250 facilities that include the faith-based and private that are able to test. So testing is services are available close to anybody. Like here, if you wanted to get tested, there's Nyanchwa, there's Getembe, you always get that tested. So I will encourage people to get tested, know your status, because let me ask you, if you don't get tested today, if you have the virus, it will take you down and people will know. If you were scared of people knowing. You'd rather get tested now when you are healthy, you start taking your ARVs, and you'll remain healthy. And if you didn't want anybody to know, nobody will ever know. So please, I encourage everybody. I know men have a problem with testing, but this message is for everybody.
My producer just disappeared, one of them, because last time when Florence was here, alikuja na kits, akatuambia fanya namna hii, tukaekelea hapa juu, and the interview was long. We couldn't wait. Tulikuwa tunashinda zile za, kitu inasonga. Where is it heading to?
We have those self-test kits, which you can do at home and know your status. You don't have to go to the hospital and wait for those results. Just take the self-test kits, come at home, test yourself and know your status.
Early this year, around Osiga, Muswat Naro, we roche after being tested HIV positive.
That's unfortunate.
Jogo, around hapa, kitutu cha chetu hapa, around town. This lady, apparently, she was found dead, she disappeared, and then she was found dead, and then the family was like, it seems she was told she's positive and she couldn't handle the same. She couldn't even look at her children. Clear mind, she decided kujirusha mtoni, and she was found dead. So there are some of the myths and misconceptions that still exist about HIV and AIDS. And especially Boniga, with this Gen Z, my friend, kuna mitandao zinaitwa Twitter, kuna TikTok. Zile majibu unaweza pata pale. I wonder how some people sleep at night and wake up in the morning with those kind of replies and comments. What can you talk about the same?
Number one, before you get tested in our facilities, we have people we call HTS counselors, HIV testing services counselors. These counselors have they've been trained on how to first counsel a patient before even you get tested, then do the test, and again counsel you after the test. That should be done really properly, because we don't want such cases where a patient will commit suicide because of the results. That shows that there was poor counseling or no counseling at all. So that is number one. As in, where there is testing, it has to be by a counselor, a trained counselor, not just anybody. Secondly, issues of social media. I know at times it's difficult to make sure that our teenagers and the youths do not access this site. But I would want to, number one, tell parents to take charge of their children and youth. Most times, parents have left the responsibility of bringing up their children to their teachers, to, some have just been left there to navigate life on their own because the parents are very busy. Out here, if you don't get information from your parents or some responsible people, there's a lot of information out here, some that is misguiding, some very misleading information. So my advice is to the parents. You must know what your children are getting access to, what information they have. They need to have the correct information. Once you have the correct information with you, even if you access any other information out here, you can tell somebody, no, that is not right. The correct information is this. And that is why we were talking about the youth-friendly centers, for example, because there they'll get the correct information. You'll come, oh, there's this information on TikTok, there's this information, is this correct? You'll be told whether it is correct or not, and you'll be counseled on how to handle it. So if we sleep as a country and let our youths and our children access information anyhow, then we will be lost. And that is one of the reasons why we're having this conversation, these town hall meetings and the media. We need people to be responsible, especially the source of the information is very, very important. Yeah.
All right. And now another thing is, over time, there is this guy called Mr. Bernard. Mr. Bernard was my teacher back in primary. Alikuwa ananifunza maths and science. Na time tulifika topic ya HIV and AIDS, alikuanga na ile yenye anawatisha proper. Mpaka nawaambia venye tembe zinatoshana namna hii. Na unafaa kumeza sijui after every 1 hour. So you could be scared to death to even do the same. But over the years, hizi vitu zimechange. Kwa sababu kwenda kuya mariogo no motoliro. Okunyu naende kuwakora naende kuwachukua koi. So I don't know if it is the language or it really used to happen, or on the same. But there are some changes, there are some new technologies and innovations that have come all along. Mpaka setuikirevo nikasikuizi hata tembe Florence Protas, they were too, you just, and I was like, actually it was the first time I saw them. And I also have a cousin, and there was a time she can be really low, especially being in a boarding school. Abana, they can question, you don't have to tell them. And sometimes some teachers can use you as an example. Sometimes someone can link an information and itembe shule. So those things still happen. Maybe are there any new technologies zinakuja labda mtu anafaa kutumia itembe hata once a week, ndo wasichoke hiyo kukunywa kila saa, as much as yes we are growing and it is changing and it is getting better.
Yeah, so that is true. I said previously that we have really made progress in the management of HIV. The pill burden was very high. And you know there are some people who have issues taking oral medication. So the pill burden, and especially if you add another condition, maybe you are also having TB or you are diabetic or whatever. So if you add all those pills, it used to be a very big problem. So that has changed. The teacher was not far from the truth. That has changed. The pill burden has reduced. And most importantly, the drugs that were there previously had some side effects, serious side effects. A number of those drugs have been phased off.
Yeah.
We have now drugs that are very effective on the viral load suppression with almost minimal side effects.
All right.
So we are very happy with that, even including children. They used to have some drugs that were very bitter, but right now they are very palatable. The children are able to take them. We are very happy about that.
Yeah.
And for the schools, I know, especially when children go to boarding schools, you realize nowadays they are checked at the gate. And previously we used to have incidences where a teacher could remove those drugs and ask, what is this, nini, I'm embarrassing the students to the effect that they could stop taking the medication. So what we have done nowadays is that we have engaged with schools. We have identified a mentor, a teacher who is a mentor. They're able to identify, we link them with all the children in that school who are taking medication, and they're able to support them take the medication without any stigma, harassment, you know. So that has assisted a lot. Because one of the issues about viral suppression among teenagers is that they're in boarding schools, they are unable to access their medication because of fear or whatever, or they are not allowed to come to the clinic. So we have sorted out, we have tried to sort that out by...
We usually have dates zenye,
Yes,
tunamwendea anaenda hospitali for
exactly.
check-up, and she goes back.
So we are working on that. Maybe we could have one or two schools that are still harassing our patients.
They do exist.
Yeah, so we don't encourage that. You had this year's theme is my health, my right. So it is the right of that patient to get the medication, not to be harassed, not to be stigmatized, not to be discriminated. So we encourage everybody to support, because one of the things that we do during World AIDS Day, other than remembering the people who have died, we acknowledge those who are living with the disease and support them to continue living positively, taking their medication so that they can live a healthy and long life. Yes.
All right. Now, today there is a town hall event at Kisii University in preparedness for the World AIDS Day. What is that one message that you are hoping that by the end of the day itakuwa imefika nyumbani, ile ujumbe ungetaka ikuwe kimestake kwa mind za hawa vijana?
Hawa vijana, I have about 3 messages for them.
All right.
I want them to realize that they are the future. They are the future of this nation and this world, that they need to be responsible and to get the correct information about life, and more especially their health and HIV, and to come out and get tested, take their medication if they're sick, continue taking preventive measures if they're negative, and spread the gospel about being safe to the rest of their colleagues, and supporting their colleagues who are positive. Let's minimize stigma, let's minimize discrimination, and ensure that gender-based violence in whichever form is done away with.
Okay.
Yes.
Lakini stigma, kuna some who are really toxic.
Yeah, you know, especially in Kisii. By the way, if you go to Luo Nyanza, There's no stigma. I've worked in Luo Nyanza, and people will come and queue, you get your friend, your relative, it's nothing. But here in Kisii, you will get...
Niende line pale ya ARV,
it will be everywhere in your
jirani yangu
village.
pale,
You know.
I will go to line ya watoto.
Exactly. Unaona? So we don't want to, that should be a thing of the past.
Wow.
Completely. Yes.
But again, this year, where is the day going to be commemorated in Kisii?
Yeah.
And what are people looking forward to that day?
So after these town hall meetings, which are opening everywhere in the county, we'll have the World AIDS Day, the 1st of December at Sametha Stadium.
Okay.
In Bobasi constituency. What we do, we usually, it is on a rotational basis. We usually make sure that we have gone to all the sub-counties.
Okay.
And here we basically meet, we have some speeches, we have some football matches, we have those who are living with the virus who have come out openly, coming to tell the rest of the people how it is, what the medication has done to them, how to live positively. Those are the best champions we have, those who have come out openly. We have many of them. We even have mentor mothers in our clinics. So they are the biggest champions, because if I'm positive and I'm guiding people who are positive and they see how healthy I am, how positive I am, they tend to listen to them than a healthcare worker, for example. So we urge them to come out, and they usually come out in good numbers because that is their day. We try to step back and let them have that as their day.
All right.
Yes.
Wow. And maybe the message to the local or mwananchi wa kawaida, especially in Kisii County, what is your message? How would you like them to support you in the same?
So our target is by 2030 or by 2027, according to our president. So we want to make HIV to be not to be a public health problem. I mean, we want to achieve what we call epidemic control of the disease. So to the population at large, number one is that we need to end stigma and discrimination in Kisii. Kisii stigma is still really high.
Let us be honest.
Very honest. It still exists. We need to end that. Let them come out and get tested. And let's support those who are living with the virus. Yes.
Because it was on a short notice, thank you so much for kukuja, and I hope that now we're going to have a real interview that is scheduled for the same, because I would like to know from the general preparedness. You can see nilikuwa nimepanga maswali kadhaa, but time can't allow us. Awareness and education. We have access to treatment and testing, collaboration with the community and the community involvement. We have innovations and future plans. We have addressing the challenges, what can really be done. I have call to action. Next time we can organize it well so that we can talk about the same. But on the event that is going to happen today, we wish you luck. Maybe any message that you'd like to pass out to mtazamaji.
No, I mean, let's meet at Kisii Town Hall and talk more. I think we have more experts. It's a big panel. A lot of that information will come out during those discussions. So right now I'll urge people to tune in during that time and learn more.
Tutakuwa live hapa Kisii TV. Just tune in. We'll be bringing the conversation live from Kisii University. Thank you so much for coming despite the short notice. I'm hoping that you'll come again.
Yeah, thank you, Kisii TV, for this privilege. For sure, I'll come again.
All right. Ambe muno kegimo mwancho murigererio Kisii TV so kunyara gusanga na nchi gorutwa chagete ko minebere chama mitende ko kwana kigusi. Next time ndo tutakuwa na kigusi. All right. All right. right, thank you so much. Bali bonse twawatirane na barabukuru 12 chamambi gwikira boni gachinse satone no suchabere nganchere me kunyara kubata pomagene eri anyara kuminyoka sege karege korekana se university ya Kisii batukunyara kwandira abasite kutogendete kuyarige guchaseri kuri kunyara kurubumanyi na kunyara kwinyura bali bonse babere bakunyara kurara gwetera se binyinyi binyamoleo bali bamenyete na birobyo na bali ya tukunyara kwandira baba kunyara gwitanga kura se binyinyi biga abana mbakontekera se 12 na siku watoto alfa ina jenzi we my lord ento wende tu ngokora chiskuru tonga na ila squeeze watoto tangu zenye wanafanya
chakula wanakula siku hizi
watoto wanakula
vizuri kabisa
watoto kama ko 12 years amako 18 amako 24 but we wish you luck on today's event. We'll be there too, tutakuwa live pale watakuwa kifuata, but thank you so much kwa kukuja mbona uchasomo ligere twara litukuligia director zake Kenya nero lenga sense mendige studio luke John kwamboka nyasayo. Thank you.
Bia bwana.
Kyombe gekurwanya endwari ya National Syndemic Diseases Control Council NSDCC kubatirana na Kisii and Level Trust Initiative Kete KCDF USAID Kisii Television namo nababwatani bande bakwariganirie egikare gyenkwana ya bene Jumatane y'ekitariki ya 25 omutyenyo y'ekomina mu mwaka w'ekirwi 2024 aria University ya Kisii igo umerana nababwatani aho asenkwane ya bene gati abo Florence Ogero oyo okora emiroberi yo gukwanira enyamoreo n'amarwairande ase county ya Kisii omobisa omanene bw'obochenwa ase county ya Kisii Dr. Richard Onkware Dr. Lucy Karani oyo okora ensemo ekurwania enyamoreo ase University ya Kisii Dr. Rose Otieno oyo clinical psychologist Kisii University Dr. Magdalene Gesare omuteneneri omanene bw'ekyombe gya Chitchat Lydia Mochengo na Richard Maregeke Mosi kurwa sensemo y'obochenwa gati y'abanda bange egikareke nigokera korokane ase University ya Kisii gochakera chinsesato chamambia na kwirurukigwa AMS ya Mona Kisii Television na baigo korokigwa ase mitandao yetu ya Kisii TV amandegere yomogusi ekyombe